The Canadian Cancer Society says that new health warnings printed directly on cigarettes is an unprecedented innovation that will reduce smoking. Canada is the first country to adopt the regulation that will see retailers sell only packages carrying cigarettes with warnings by July 31st. Dr. Peter Selby from Toronto's Centre for Addiction and Mental Health is hoping that the warnings will nudge some people to rethink their smoking addiction, especially younger Canadians. Joining us now to discuss this is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you so much for joining us.
Good to be here.
Before we talk about the new warnings, how common is smoking in Canada?
Well, the prevalence of current cigarette smoking amongst Canadian adults, we usually do it age 25 and older, was just around 12%. So this translates to approximately 3.2 million Canadians. Adult men are around 14% and adult women around 10%. And even though we're talking about these small numbers, the impact of that is that we are seeing an estimated of 20 to 21,000 people who are expected to die from lung cancer in Canada this year alone. So there's a real need to change this trajectory by looking at ways to curb smoking.
So, what do you make of the Cancer Society's claim that individual warnings will reduce smoking? Is there any evidence to suggest that this is true?
Well, their claim is based on some evidence. There, the University of Stirling had suggested that putting health warnings on individual cigarettes could really play a key role in reducing smoking. This, with the understanding and assumption that we are looking at youth who are experimenting with borrowing cigarettes from a friend and therefore see that warning. But keep in mind, these are a very novel approach. As you mentioned, Canada is the first country to implement this measure. Australia is thinking about it in the near future as well. So we don't have enough evidence quite as yet to see if this novel strategy will make a huge difference for us.
In terms of a smoke-free society, many have pointed to other jurisdictions like Sweden and elsewhere who have embraced a harm reduction model and gotten people off of smoking by promoting products like nicotine pouches. Do you think that is a viable approach Canada should be taking?
Well, Sweden is basically on the verge of becoming smoke-free as a nation. And a lot of this success has been due to the use of nicotine pouches or snus, which are considered less harmful than cigarettes. So nicotine pouches, for those who don't know, are these tea-like bags that you would put in your mouth, usually between the gums. And what that would do is actually reduce cravings because it actually contains nicotine. They're not 100% safe or risk-free, but at the same time, it's really hard to ignore the results of having an almost smoke-free population. So definitely some lessons we need to learn here.
And what about vaping? We know that in the UK, their health regulator has said the vaping is 95% less harmful than smoking. Do you agree with that statement? And how should that drive policy decisions?
Well, it's interesting. I think their estimate is based on their review of the current evidence that shows that e-cigarettes are significantly less harmful to health than tobacco. And now, while e-cigarettes are considered less harmful than traditional cigarettes, they're again not risk-free. They deliver nicotine, which is an addictive substance. And we have a new health condition called EVALI, which is an inflammatory condition that tends to happen with e-cigarettes as well. But what they are saying is, as a harm reduction model, absolutely, e-cigarettes are much less dangerous than cigarette smoking, and they're embracing this model to help.
And it's important to ask, while some of these alternatives like vaping and pouches are less dangerous, they still have nicotine in them. What should Canadians know about nicotine and nicotine addiction?
Right. As you mentioned, it is an addictive substance there. It can negatively impact brain development, especially in teens and young adults. It can also cause quite significant cravings because it stimulates the release of dopamine in the brain. So you get these feelings of pleasure and contentment, and that can make it very addictive. So when a person tries to quit nicotine, they experience withdrawal symptoms, and those cravings come from nicotine. And the concern, of course, of all of these other models is whether that craving then may translate into cigarette smoking later on.
What else can Canada do to curb smoking rates?
So I think, we're talking about tens and thousands of deaths looming due to cigarette smoking. I really think we should look at the problem from a diversity of approaches. I think Sweden and UK have made great strides, and they've adopted a very strong harm reduction strategy. And frankly, it seems to be working. As what we've seen in the studies, tobacco smoking is much more dangerous than nicotine. or e-cigarettes here. So I definitely am in favor of adopting these approaches as well as other approaches to really reduce the negative effects of cigarette and tobacco smoking.
Thank you so much for your time.
Okay. Thanks so much for having me.